We've got a pretty critical mass of participants, and I'll keep an eye if anyone's joining late.
All right, so I appreciate people putting things in the chat box. I'm probably not going to be able to keep an eye on that. I do have a PowerPoint that I'm going to be sharing with folks, but I see that a lot of people are saying that they're home with little kids. I am too. I kind of forgot when I said yes to this, that this is a virtual day and that my 5-year-old is home. And while the house is very child-centric with toys and games and the most fun things for her to do all over the house, she's completely bored and doesn't know what to do. So we'll probably try and derail this in a really adorable way. So I would say, like, I'm in this with you. You're in this with me, and we'll see how it goes. So for folks who don't know me, I'm Amy Johnson. I use she, her pronouns. I am the director of the Parent-Child Center at Northwestern Counseling and Support Services. So we provide supports to families in Franklin, Grand Isle, and we do some light Chittenden County work as well. I'm also the co-chair of the Vermont Parent-Child Center Network. So I'm going to speak about our platform, our legislative platform, but I'm kind of going to level set first and talk about what is a PCC, how many are there, just to get everybody kind of on an equal playing field, because I'm not completely sure how familiar folks are with the Parent-Child Center and the network and who we are and what we do and why we are always at the legislature asking for jazzy things. Nancy Bloomfield, who's down in Norwich, is also on the call, and I chatted her and said, "You're my co-presenter now." So that's fun. It's not planned. We haven't even talked to each other about that, but it's just happening. So Nancy, if you want to add anything, let me know.
Okay, I'll chime in. And it's nice to see that there's a couple of board members from the Family Place who are here, and Lee Lauber also. It has a long history with the network, so great to see all of you all.
So I won't have time to do introductions of all of you wonderful people, but please, if you want to put information in the chat about who you are and you know, why you joined the session today, that would be great, not required. And Nancy, if you want to keep an eye on questions, let me know. So I'm going to screen share and I'm just going to go right into it because I'm really chatty and I crack a lot of jokes and I eat up a lot of presentation time doing those things. So in an attempt to get to real content, I will start the screen share and then I won't be able to see any of you. So that'll be fun. So yay, Parent-Child Center Network, woohoo! This is our new logo. It's really jazzy. I'm really excited about it and just wanted to put a note in that we have a new logo and a new website. So visit us if you want to learn more, get some great detail about who we are, what we do, how we formed, where we're at and where we're going. That's a great place to get additional information. And I don't have the email or the website address listed anywhere. So you can Google it or Nancy can put it in the chat box, which is probably easier. So I'm going to see if I can actually advance slides. I cannot. So let me, I knew this was going to happen, crew. Hold on. So I'm going to try this again. Yes, okay, I did it. That was quicker than earlier this week when I did a presentation and went really off the rails. All right, so you can see this says universal access across Vermont. So we have 15 different parent-child centers. representing 12 regions serving all families. So our parent-child centers have universal supports for all families, and then targeted supports for families that are experiencing various challenges or barriers to a variety of things connected to basic needs and protective factors. And so we'll dig into that a little deeper. And yeah, but I just thought this was a jazzy map of Vermont. Yay, very colorful. So here's the parent-child center. This is like such a PowerPoint faux pas. There's so much text on this, and I'm okay with that. But kind of the salient points of this slide to know is that we are in statute. We're written into statute. That happened in the 90s. And that's important because part of our legislative ask is for you to support our bill to enhance the statute that currently exists. And so if you're not familiar with parent-child centers, we do prevention, early intervention, and early identification work. And so I'll talk about our 8 core services later, but really it's that multi-generational approach, strengthening families, enhancing protective factors, parent support, parent education, referrals. If we don't provide the service, we're plugging people into the services in the community to, keep them connected and wrapped tightly in whatever it is that they might need. And so the Parent-Child Center is a network, so we're our own 501c3. We meet monthly as directors, and we really work in unison to make sure that we have the highest quality programming. We are unique unto each region because we should be, because the regions are different and they have different needs. And then we're connected through our 8 core services. But we try and strive for high quality programming, and that continuity of care is really important for us. So if somebody moved from one region to another, they would know that they could be strongly supported by the Parent-Child Center in that region. So I talked about this already, but universal access, I think this is really important. There's often, I hear, well, parent-child centers are for families who are Medicaid eligible or have like major barriers or are at risk. And what I say to that is we have something for everyone. I think about, when you think about the perinatal period, families pregnant and postpartum, that is a critical time for all families. That is hard for all families. Postpartum depression doesn't discriminate. So there are risk factors that increase the chances of that happening. But what we want people to know is that everyone needs help. Being a parent is hard. It's wonderful and joyous and all those other clarifiers, but it can be really challenging. And so we're here to help. And so we have kind of a broad range of services that support families universally. I put a couple things in here: perinatal supports, play groups, which right now a lot of those are being held virtually. We've got child care centers embedded in most of the parent-child centers, though not all. Mine is one that does not have a child care center. And so then we also have supports for vulnerable populations, families with children with developmental barriers, social emotional challenges, families that are involved with DCF family services, challenges with substance issues, homelessness, food insecurity. I know you can read, but I'm just having a jazzy time focusing on that bullet. Generational poverty. So we do have targeted supports. And so really, again, that kind of PCCs are here for you. There's something for everyone. And then I can't really see this because my screen share is blocking it, but we serve about 14,000 children annually. And in this past fiscal year 20, we served 50,000 children, youth, and adults. So across the network, which is awesome. I mean, that's just really exciting data that we were able to pull. So I will not read this. These are 8 core services. Like I said, sometimes we hear as a negative, you've seen one parent-child center, you've seen one parent-child center. I think that's a good thing. Again, we should be really in tune with what's going on in our region and identifying those gaps and having our ear to the ground of what the needs are for families. And so we all do look unique, but where we are all strongly connected is in these core services. So again, playgroups, parent support groups, caregiver support groups. Concrete supports is a huge one, and I'll go into what that looked like during COVID. But we have our CBCAP funding where families are able to chat with us about struggles that they might have, maybe paying a utility bill or an auto repair or school supplies for their kids, and they can connect with us and we can help to provide them with funding for those items. But really it's diapers, wipes, formula, cribs, kind of you name it, like food, groceries, gas cards, phone cards if they have prepaid phones. So really kind of anything that we can help families to meet their basic needs. Either we can support families or plug them into a group that can. Community development is a big part of our work. We are always making sure that we are in meetings talking about what's going on regionally, statewide, and really making those connections and building a roadmap for the future in collaboration with our state and regional partners. Parent ed, we do a lot of that. That's we all have a lot of groups and workshops running right now. Info and referral, this is huge. People call me and I feel like I pretty much know every resource that exists in our region. And so again, if we're not providing it, we're able to plug people into that support and really that kind of following up and making sure that families get what they need and closing the loop on those referrals. Home visiting, that's, meeting families where they're at. We're family centered, family led, meeting families where they're at. So a lot of the work that we do is in the homes and in the communities. I will say that even though COVID kind of changed the game for service providers, I think there might have been 1 month where we kind of pulled back and moved, fully to telehealth, but it didn't take long before we realized that just wasn't going to work and we needed to be in the homes. And so I can speak for, the network, but specifically my folks have been going into the homes since, back into the homes since May of last year. And I know that thank you to everyone who's had a part in helping folks get vaccinated. Many of our PCC staff have been vaccinated, which gives us, lets us breathe a little bit more easily thinking about our folks going into homes providing supports for families. And then early childhood services. So like I said, most of us have childcare centers embedded. I don't, and the way that we support early childhood services is by supporting the providers in our region with kind of anything that they might need, whether it's, coming in and supporting them in their center, making connections, making referrals. But many of our sites have childcare centers embedded and they're therapeutic in nature. And then I just put this in here because it's kind of neat that our core services are directly in line with the CDC's recommendations for strategies to prevent ACEs and build resiliency. So you can see that at the bottom, they're very, very in line. And so we're always doing that. We're aware and cognizant of ACEs. We know that lots of families have ACEs and the families that we're working with have high ACE scores. And I kind of like, what are ACEs? So what, now what? It's kind of that, we're in that now what, so let's build that resiliency, and that's really our focus. Do not read this. So I just want to give an example of something that we worked on as a parent-child center. So I talk about all the good work that we do, but this is kind of like, what's the stories, like the family stories that exist. So we all built these kind of one-pagers about families that we served and how the parent-child center and the wrap of supports for those families kind of changed their story, changed their trajectory. And so on the front page is a long story about the family and kind of their experience and the supports they received. And on the back side, it has the return on investment. So that money that was saved by, you know, keeping kids out of DCF, by keeping a family out of like the corrections facility. And so this is a story about Paige. She came to us, the Parent Child Center, through Reach Up. We plugged her into many different programs, but effectively, you know, she had an infant loss. She had a child in custody. She had interpersonal violence going on. She was homeless. She didn't have a job. And through the wrap supports of the Parent Child Center, all of that changed. She, you know, got into an education opportunity that allowed her to be plugged into a job. Her child, you know, came out of DCF custody. She, you know, found a home, got a car. It just really changed the landscape for her. And so this, again, it just kind of talks about the savings. So this is, you know, the cost of a child in foster care, the annual average cost per case. And then it just talks about kind of the cost savings of all. So this is the thing, prevention isn't sexy. I think it is, but a lot of people don't think it is, because you have to wait so long to see the gains, to say these things that we did early on save the state all this money down the road, if people like to talk about the dollar value, but it's also about the impact that it has on lives and the impact that it has on the health of our state, the impact that it has on the health and wellness of our families, and that kind of like healthy, happy, well lives into the future, like now and into the future. It's hard to like have data on that, because to say like, oh, we did this work when the baby was born and now they're living this happy, healthy life. Like, how do you show like down the road, like articulate the gain? So this is how we did it. We talked about that return on investment. And then we had the like heartstring story for, you know, folks that wanted to hear the story. And this is for the numbers, folks. So I should probably pay attention to the time, because I'm going to eat up all the time chatting. So I want to go into, this is kind of laying the framework for our legislative ask. So one of the things that the Parent Child Center has recently done is join the National Network of Family Resource Center Networks. So that's the National Family Support Network is what it's called. So we've joined the National Family Support Network, and effectively what that is a statewide networks of family resource centers. So it's like groups of parent child centers all over the country. And so we've joined them, and what this organization does is ensure coordinated quality supports for families. And they've created national standards for family resource centers. And so we have, as a Parent Child Center Network, adopted these national standards. There are 17 standards, and basically what they do is ensure that you're providing high quality care to families. And what this looks like on the ground for us is 2 of us are trainers. I'm one, Margot in Springfield is the other. And we work with all of the centers to train them on what the standards are and then how to use the self-assessment. And so the self-assessment is something that is done annually with a stakeholder group in the region connected to that center. And you look at all aspects of programming to ensure that your minimum quality, which is not low quality, that's still quality, striving to high quality for your entire program. And so we have already trained several sites and have worked on that annual assessment with several sites and starting to build that roadmap of ensuring that all centers are like firing on all cylinders and providing high quality services. I feel like I don't want to say too much more because I don't want to eat up too much time. But again, it's that continuity of care and ensuring that we are providing high quality services to families. And then that's, you know, also connected to we do peer reviews every 3 years. And so that's connected to our peer review process as well. So this is talking about what we did during COVID. So part of our legislative ask is COVID relief funding to the tune of $3 million. And we this was all the stuff we were doing. This is just kind of a snapshot of the 15 parent-child centers before we got COVID relief money. So, you know, it appeared that our doors were closed, but we were really working our buns off at the start of COVID to make sure that families were wrapped in supports. A lot of us, you know, sought out funding, like outside funding, to be able to get more concrete supports, set up delivery systems to drive things out to families when they couldn't leave the house. So this is categorized in our 8 core services, but this is just a snapshot of the work that we did prior to getting COVID relief funding. And then we did get $1.6 million in that federal COVID relief funding in kind of phase 1 and 2. And I'll speak to, you know, what we did with that funding. But really, when this crisis hit, we really came together and said, you know, we're a hub. We're going to make sure that we are there for families. We're going to help them to meet their basic needs. We're going to give them education and support. We're going to keep our child cares open as much as we can, and just really came together to support families across the state. And so we did a lot, and the $1.6 million that we got from the feds helped us to do even more. And so this is kind of leads into that. So this is Luna, it's her chasing bubbles. So our $3 million ask in this next phase of COVID relief funding for COVID response and recovery. And so we already got $1.6 million. We supported resources for healthy staff and families. So, you know, that looked like a lot of different things. We had thermometers that staff could give to families so they could check their temperatures before they sent their kids to school. We had masks and, you know, PPE, and we did like the clear mask so people could, when you're working with kids in early intervention and you're trying to articulate so people can see your face and your emotions and how your mouth's moving, and that like speech and language development. We had, you know, hand soap, kind of anything that families couldn't find that was going to keep them healthy and well, and our staff. So that was a lot of money was pumped into that. Basic needs supports, I've already touched on that. I mean, really, diapers, wipes, formula, cribs, everything that families were having a hard time finding or funding themselves because people's life situations really shifted. You know, we had the families that we had already been working with, and then this whole new wave of families kind of came on board because everyone struggled, and a lot of people lost their jobs and had a hard time meeting needs. So we put a lot of money into that. Materials to augment the center to allow programming to continue that looked like partial walls and plastic screens and kind of everything that we needed to do to, you know, be on the up and up to meet VOSHA regulations to be able to be open. Virtual funding of virtual platforms, iPads, different ways to be able to help families to access services, Zoom accounts. This is just a small snapshot. We have a longer handout, which if you're on the, I don't know how to say this platform, this fancy fun platform, I uploaded some different forms, and one of them is I call it our one pager, but I think it's like 7 pages long, that speaks to everything that we did with the $1.6 million COVID funding. And it talks about it globally, and then it goes center by center, and there's pictures, and it talks about our $3 million ask. So I'm just going to pause for a second because I always get like bouts of anxiety when I see like the chat blinking. So I know there's a lot of chat. I don't know if people are asking questions.
Hey, Amy, I'm monitoring the chat. If there's a lot of comments, folks are supporting the idea that case studies can be really effective. There's a couple of requests to get the slides so we can talk about how to get that out to people. And lots of thumbs up and support, which is really appreciative. And thanks
Yeah, that's awesome. I assumed that you would let me know if people were asking questions. But yeah, so I just wanted to make sure because it keeps blinking, and so I'll just assume it's like, yay, awesome, PCCs are the best. So I'll just keep going with that as the trend. So again, we are asking for additional funding in this next wave of COVID relief and recovery for $3 million. If we do get the full $3 million, the idea is that we would split that equally across all 15 parent-child centers. And so there's just a lot of ways that we can use that, whether it's to do additional enhancements to the center. We've talked about COVID coordinators. I mean, I will tell you that the work that we have done connected to COVID is, I have like a team of folks, I'm not going to say similar to VDH because I know those folks were redeployed, but I do have some staff that have effectively been redeployed to be focused specifically on COVID response and recovery, concrete supports delivery, and kind of managing and tracking all the data for that. So it's a lot, and there's a lot more that needs to be done. And I don't think it's lost on anybody that there will continue to be an increased need for supports. That kind of human services tidal wave that is upon us and continuing to come, because we're still in this, it's not over. And so we want to make sure that we're well positioned to support families. And PCCs are chronically underfunded, and we can turn a nickel into $100 is kind of how I feel. Like we just keep doing the work because we know the work needs to be done, and so we can't say no. Like we're that for a lot of families, we're that lifeline, and so it's really important to make sure that have the funding to be able to provide the supports for families. And so that's why that ask is what it is. $3 million looks like a lot when you spread it across 15 centers and you think about the population in each region. Again, we support all families. All right, so so now the PCC bill. We have a bill. Jazzy times. S91 for folks. The S it's introduced in the Senate. And so Senate Health and Welfare, we had a variety of sponsors, not as many sponsors as the Let's Grow Kids bill. We love that bill. That's jazzy times too, but we did have some great sponsors. And so I think it's helpful to remind folks that we are already in statute. So this isn't like a new charge up the hill. This is like, we have it and it needs to be enhanced. It's pretty old, and we want to make sure that what we're adding to it is that what speaks to that quality, to ensure that there's language around ensuring that our services are high quality, that continuity of care, again, and that accountability. So we want to be held accountable. We want to be able to say to our funders that this is what we're doing, kind of that how well is anybody better off? We want to be able to make sure that we're able to articulate that, how people are better off, how the work that we're doing is supporting families and turning the curve, right? And so the statute kind of enhances those pieces. So you can kind of see the bill proposes that accountability among and distribute funding to designated parent-child centers. It talks about the criteria for designation. That's not very different than what already exists. Again, I'm not going to go into great detail about all the ways for us to become designated as parent-child centers, but providing those core services, having family representation on the board, being part of the peer review process, adopting the national standards, and a variety of other things. And then it kind of speaks to kind of that redesignation process, kind of similar to designated mental health agencies, that kind of on a we do the peer review every 3 years. Every year we're looking at the national standards and reassessing our programming to ensure that it's high quality and where we need to work on to continue to move the needle on that. But that, you know, kind of looking at like our maintaining that designation and what the process is if there would be a need for another center, like maybe if the landscape changes or a need shifts or a center shifts, you know, if another parent-child center were to exist, how would that come about? And what the process looks like for that, which is interesting because somebody asked me the other day about that for a report that they were writing for the state. And I said, well, it's not actually written into statute, but in the new bill that we're proposing, it does have that written in there because that's important and it should be in there. And then, so I think that one of the big things that's in there is there's an appropriation of $7.5 million. That sounds like a lot. And again, right now we have a little over $3 million across 15 parent-child centers to provide our core services. We have done a great deal of work to talk about what is the dollar amount of a fully funded parent-child center network, and that number is $10 million. And so that 7.5 added with, you know, the amount that we currently have, that's kind of where we came up with that, which includes an inflation factor. So we know that each year things cost more money, and so you have to build in that natural inflation factor. So those are all in there. Sorry, there's a couple things that are a little bit not jargony, but just kind of detailed. And so the other piece is that the bill establishes that the PCC, as it establishes the Parent-Child Center Network as an agency of human services community partner. And so really that's strengthening that partnership that exists, that we do want to work in collaboration, in strong collaboration with AHS and our state partners. And again, being held accountable and being able to articulate the value of our work through data, through continuous quality improvement. And so that's all written into the statute. Nancy, do you want to add anything? I feel like I've been talking a lot, and I just want to see if I've missed anything.
I think you've done a great job. I think, but it would be great to hear, you know, from others what questions you have, because I sort of know a lot about what you're saying. So I think it'll be wonderful to hear. And I think a couple of times though, you've mentioned the importance of being able to capture what the impact of our work is. And I think probably most people in this group can really relate to the situation where we all really want to be able to spend energy collecting data, meaningful data, understanding what impact we're having, and identifying the areas where we need to do better on behalf of children and families. And as everybody knows, having sufficient funding is a really big contributor to being able to do that kind of work in terms of quality improvement. So I think that's a really important feature of what we're trying to do in this bill.
Yeah, absolutely. Yeah, it's kind of that, always, like, the way that they talk about it at the national network is always arriving, never there, which can sound daunting, but I think that's, you know, it's kind of that we're always looking at the way to do our work in the best way possible. And so we're never at the finish line. We're never like, yep, we're there, we did it, because there's always improvements that can be made. There's always something new that's happening that we need to address and build programming and supports around. And again, it's that, you know, meaningful data, continuous quality improvement, and articulating instead of widget counting, which, you know, I can say I served 20 families, but if I just popped in and said, hey, what's up, check you later, like, was anybody better off? Like, really being able to demonstrate that people are better off. Nancy, you have your hand raised.
So there's a question in the chat, a great question.
Sure.
From Lori, who said, can you talk to the process of the bill? So where is it right now? Where does it go next?
Yeah, great question. So it was just introduced. We haven't started testimony on it right now. I know that it's looking like myself and Donna, who's the co-chair, will probably be providing testimony. I would guess sometime next week. Hopefully not this Friday, because I haven't finished my testimony yet. But yeah, so it's just been introduced. It's, you know, sitting in Senate Health and Welfare, and it hasn't gone very far yet. We haven't. It hasn't been marked up. We haven't sat down and provided testimony. So it's really in its kind of initial phases. And I will say, which I think it's important to note, that last legislative session, we introduced the bill. It was introduced in the House and the Senate. It made it very far. And then COVID happened. And it really, you know, we really had to shift gears. Like, we wanted to keep pushing it forward. However, it really was about, like, you know what, this is a time to focus on families and COVID response. And so, you know, we kind of had to, as the biennium, we had to start from scratch. And so this was the version that we had got to. We had sat in Senate Health and Welfare and added language around the national standards and kind of enhanced some of it. And so that's the version of it that we decided to continue to push forward. So we're kind of starting from square one again this legislative session. And so it's really in its, you know, beginning phases. I just want to see what else I have. Oh, perfect. So I'm not the only person that you can contact about the network, but in the wee hours of the night when I was finishing this, I just kind of went with this. So I am the co-chair. If you have questions, you can email me, and then I can funnel you in to a parent-child center in your region if you have more specific questions or want to connect with your regional folks. I have all that information at the tip of my fingertips, so call, email. I'm going to stop screen sharing because, so I'm going to leave this up for a second if people want to jot this down, but it sounds like we're going to send out the slides. I don't know how to do that, but we'll figure it out. So I'll stop sharing. Now I can see you all. That's so nice. So we have a little bit of time. Somehow my child has managed to not come in here and interrupt. Knock on wood. There's still 10 minutes left. So I guess I would just open it up to questions, thoughts. Yeah. And don't forget to unmute yourself if you have a question.
Not a question, but a thought. Just thank you so much. So great to learn about this, know more about it, and thank you for the hard work you do. We really appreciate it.
Thanks.
This really has been helpful. Do you know if we have friends that are supporting this bill? And if so, who are they? Where are they? So we know where to work hard and thank people.
Yeah, that's a great question. I would say we have a lot of friends in the legislature. So if you're connected to folks in your delegation, I would say that, you know, it's hard to name all of them, but I know House Human Services, so many of those folks have been supportive of the Parent-Child Center all along the way. With COVID relief funding, with the bill in this iteration, the previous iteration, Senate Health and Welfare folks. We have some real champions in the legislature. And so if you are going to a lunch session, just thank your folks for their continued support of the parent-child centers. I don't want to make any assumptions about other groups who we work with who are supportive of us. I do know that our work is appreciated by our strong partners like Building Bright Futures and Let's Grow Kids. You know, and so I don't know, Nancy, I don't want to like name anybody who's like, actually, no, we're not. So that would be awkward. Who am I leaving out?
It's been sort of a long say, long-standing effort to really try to build relationships with our legislators in each region. So I think just in terms of thinking about advocacy, we feel like we're introducing this bill with some support behind us, in part because of all of that work that's happened over a number of years, trying to help, make sure that each legislator understands what the Parent-Child Center is and does, and because the work is so broad and because it can look different in each region, sometimes that's been a challenge to try to help provide that grounding and understanding for each legislator. So I think what we're starting to see is that work really pays off over over many years of that advocacy. That's what allows us to be able to bring a bill to get some support for introducing the bill.
Yeah,
so a lot of work
really,
by people over a lot of years.
Yes. What I get really excited about. So yeah, definitely thank your legislators. I think pretty universally folks are jazzed about parent-child centers and have like, they get it now. They understand the work and why it's important. And I get really excited when I hear somebody in a session or in a committee mention prevention. Years ago, like you didn't hear that, and now you're like, what about prevention efforts? And that's really cool. Like it's, was a long time coming. And so people are really getting that. Like I said, prevention doesn't always feel like that shiny thing, but people are seeing like, hey, this is really important and starting to mention it. And that's a lot of the work that we've been trying to do, is to really like hold that up and say like, this is what's really going to turn the curve for our state. This is what's going to really make some significant changes for families, is that focus on that prevention piece. So yeah, it's, thank everybody on this call. I'm sure that, whether you've been talking about parent-child centers or not, you're talking about why the wrapping families in support and the importance of the early years, and really like laying the foundation for that prevention work, and why it's so important. Like all of you have done that, which is really awesome. So I would thank all of you too.
I also, I appreciate this conversation because of COVID. Also, we've had fewer visits from our legislators to our center. Prior to COVID, we were going to have a visit from Governor Scott. And in person, there's definitely an impact. So where is that impact being met in conversation? So we really appreciate all your work, making this personal connection between all of us and the legislation in a time when it's really just done through Zoom and not in person, and really relying on the stories and experience. And it takes a tremendous amount of coordination and what is really needed throughout Vermont in terms of family support. So thank you for being the voice and bringing this forward, because it's very important work, as we all have experienced.
Yeah, thanks, Sarah. I totally agree. It's definitely like a tricky thing to have the legislative work be done so remotely. You can't just walk into the state house and sit down in committee and kind of like rub elbows with folks. I think the piece that is actually kind of nice is that on like kind of on the other side of the coin is that like people can have a different type of access to legislators. Like I think about families, for example, it's hard to get to the state house. It's intimidating. And to say like, hey, you could provide testimony from the comfort of your own playroom, and so I think that is kind of a neat thing that I hope that we can kind of maintain, is that ease of access to families that might not otherwise have access to legislators or to providing testimony, because we really, like, family voice in committee is so critical and really does change the conversation, and really like the light bulbs start to go off when you see families telling their story and people really hearing, what does it really look like on the ground? What does it really feel like for families? And so I think it's this, you know, like it's not the other day, I think it was like a year ago, but I'm going to say the other day, because it feels like 100 years ago and it feels like 5 minutes ago. But, you know, we wanted to have a conversation and pull in, you know, Ginny Lyons and Ann Pugh. And it was like, oh, we'll just set up a Zoom. And here I am, 7 o'clock in the evening, like they're in their house, I'm in mine, and we're chatting it out. And like, that's just not a level of access that I've always had. And so there's the challenges and barriers to it. And I think that there's the ways that it's creating additional ways for folks to interface with the legislature.